Welcome to another COVID-19 update. I am Stacey Carmichael, and of course, I'm joined by Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's always a pleasure having you on the program.
Well, thank you very much for having me on the program.
Now, today, my first question to you, what are the ministry's plans in expanding testing capacity in the outlying areas?
Well, we're doing two things. At the National Public Health Reference Lab, we are actually trying to build more capacity there. So we expect maybe in about 2 weeks or so that we'll have additional PCR machines working at the National Public Health Reference Lab. So that's one thing that we're working on. With the existing machine, we have bought what we call an extractor. So these samples that would normally take about 8 hours for us to process, with an extractor, it accelerates the time that you need to process these samples. So yesterday we received one as a donation from the government of China, and we have another one that has been shipped, that the government of Guyana has bought, and that has been shipped. So we're expecting that to arrive very soon. But in the meantime, the one that we've got donated from the government of China, we are hoping to start using that by next week.
Mhm.
So that's at the National Public Health Reference Lab, where we'll have now more capacity and have faster turnaround time with our samples. The second thing then is, how do we increase capacity at the peripheral level, or maybe in the regions? So we have other types of machines, what we call point-of-care machines, and we've already had about 5 such machines in the country, and we were using it for other diseases such as malaria and TB. And so what we have done is to repurpose those machines, and we have serviced them, and we are ready to deploy them. The thing that was holding us back is to have the cartridges that we normally would use with these machines. So for COVID-19, there's a special cartridge that you have to use, and we have since been able to work with PAHO to procure some of these cartridges. So we'll have about 1,050 cartridges coming into Guyana, and then we expect every month that we'll get additional cartridges. So these types of machines, we're able to deploy them out into the region, and when you use the cartridge, it takes maybe about 45 minutes for you to get back a test result, and they're very accurate. So if, however, if we do a test and the results are indeterminate, then we can then always go back and do the gold standard, which is the PCR test. So that is something that we're working on. So maybe in a week or two, we'll have some of these machines deployed to some of the outlying regions. We also have another machine that we are looking at. WHO has just certified a specific type of antigen machine that can give you a very accurate test and it detects the virus itself. Those machines, we have already placed an order with PAHO WHO, and we are looking at getting a sizable quantity of tests to go with that. So if we are able to get that within the month, then that is going to help again in doing a lot of tests, especially in the outlying areas. And I think if we get them, because the price is far cheaper than the PCR testing, so it can become very affordable for us to do more tests. A PCR test right now costs us close to $100 per test, and we have been doing it for free for everyone who requires it, but it costs at least $100. So if we can bring down that cost and do more tests, it's going to be quite helpful. So these are two strategies that we're working on, and while we get those 2 strategies deployed, we are still bringing in samples from the region. So anybody in any one of the regions who got it sampled for COVID-19, we bring those samples to our lab where we can do the testing. In addition to that, I'm very pleased that the private sector has been working to build their capacity. We are aware that there's one private lab, Eureka, that has brought a lot of equipment, and they are going to start very soon to be providing PCR testing in their lab. And I'm also aware that there are two other private sector entities that have brought in PCR machines, and they also would be offering testing. So these are good signs. And between the public and the private sector, I think we will have enough capacity to handle all of the tests that we need to get done in Guyana.
Thank you very much, Minister. Now, my next question, well, as government plans to reopen the airports, what are some of the measures that are being put in place to ensure the safety of the passengers as well as the workers at the airport?
Well, the airport has been in use, but of course, there were many restrictions on flights coming in. And over the period from March to now, I think the staff of the airport has been able to come up with protocols of staying safe, keeping safe distances, doing all the measures that we recommend in terms of COVID. So I don't think we need much training with the staff. They are well aware because they have been trained over the last couple of months, and they have been abiding by these rules. Now, with the advent of more flights coming in, we will have to look at how we process the volumes of people that are coming in. So per flight, we probably expect maybe 200 or 300 persons, and therefore flights would be staggered in such a way as to allow just one flight at a time. So you wouldn't have too much of a crowding at the airport. But before you even get on a plane to come to Guyana, it is a requirement that you will have to get a negative PCR test done at the point of origin. So wherever you're coming from, you have to get a PCR test, and it must be negative. You will have to send that test to the authorities here in Guyana for us to verify. And once we verified and we are satisfied that you have a PCR test that is negative, then we will put you on the list of persons to come back. When you come back and you come to the airport, if your test has been more than 72 hours, anything beyond 72 hours, that person is going to be required to get a second PCR test done at the airport. They will have to wait at the airport or some convenient area that will be provided until those results come back. So the results would be processed, and they would get back the results within maybe a couple of hours. And once they are negative, they'll be allowed to go. If the results come back positive, well, then we'll have to isolate that person and the persons who are sitting immediately around them. Those persons will have to quarantine because they would have been exposed to a positive person. So we are taking all the necessary measures to prevent any type of importation of COVID into Guyana, but at the same time also making sure that there is safe travel in terms of people coming in, that every passenger is really safe because they have done the test.
Thank you very much. And Minister, just a little clarification and a status update on the ventilators that are expected in Guyana or are already here.
Well, you will recall that the Indian government had paid for 29 ventilators, but because these items are really scarce and they're not readily available on the market, PAHO was not able to source all 29 at the same time. So we had received a first batch of 5, which as soon as we received them, we passed them on to the Georgetown Hospital. And as we speak, these ventilators are in use at the Georgetown Hospital. So we are expecting the rest to come in And once we get those on the 12th of October, again, we'll hand it over to the relevant hospitals and institutions so that they can start using it.
Thank you, Minister. And before we close off the update, any final appeal today to persons in terms of observing the measures as we try to fight against, COVID-19?
Well, last night we launched an operation with the joint services called COVID Curb, meaning COVID and curbing COVID. So that operation has been launched. We are working very closely with the police, the CDC, and the Army. The intention is to have about 5,000 persons in various parts of Guyana, across in all the regions. And these persons would be using moral suasion, talking to people. So it's like one-on-one education. They will talk to people about the importance of utilizing the prevention measures and why they need to use the prevention measures such as wearing masks, keeping your social distance, washing your hands, sanitizing your hands. Why is it that we need to do this? And they would also, while they talk to people all over the country, they would be distributing leaflets to them with the same types of instructions. And we will also be distributing masks so that if anyone say to us they don't have a mask, we'll be able to give them one. So not having a mask is not an excuse for not wearing a mask. So we have started this program because we recognize that while the order is there, a lot of people are not complying with the order. And really, spread can happen anytime during the day. So while there are people going to markets not wearing their masks, going into public spaces not wearing their masks. So we want to intensify this effort of getting people to be more compliant with these preventative measures. We have also recruited a number of businesses and we are working with them. You will see more educational material being placed at businesses. We will be working more aggressively with business owners, especially those who are open to the public. And we are going to ensure that they understand what is written in the order. Now, one of the things that came out from the press conference last night is that if persons who own businesses do not comply with the order, you would receive a warning. The first time you'll get a warning, and on the second occasion, if you still violate these measures that we have in place, then your operations would be closed, or your business would be closed. So it is going to get stringent, but we want to be fair to everybody. We want to give everybody an opportunity to comply with the measures that are in the order. And we feel that once people do that, then we all would have a safer environment in which we operate. So the whole thrust of this, we cannot be safe if they have a few people who are violating the rules. All of us will have to pay attention to these rules and make sure that we are complying with them. And if everybody do their little bit, then the whole country would be protected. And that's the rationale that we are working with. So we have to get everybody involved in this effort, and hopefully with these new interventions that we'll see more people comply.
Thank you very much, Minister, for being on another COVID-19 update. It was a pleasure. And thank you very much, viewers, for joining us. I'm Stacey Carmichael, saying goodbye for now.